I go share screen. There you go. All right, so this is my video for the Gen Med Assignment Part 2. It's actually my second take because the first one didn't record. So case study that's given us just a brief description of it is 18-year-old male, recurrent episodes of wheezing after exercise bouts. He's diagnosed with mild asthma, prescribed salbutamol, inhaler, which is just 2 puffs when needed, and beclomethasone, which is just 50 micrograms twice a day. Drug administration, both are through dry inhalation. They're both inhalers. I know the beclomethasone can be administered through either liquid or pill form, but I'm assuming the one that he got was a dry inhalation, just like an inhaler like the other one. So that's how those drugs are administered. Indications. Salbutamol, pretty much just sympathetic relief and prevention of bronchospasms due to bronchial asthma, chronic bronchitis, reversible obstructive airway disease, or other chronic pulmonary disorders, which in which bronchospasms is a factor or a complicating factor. Beclomethasone is just used to prevent difficulty breathing, wheezing, chest tightness, and coughing caused by asthma. So these are definitely the case study definitely fits these indications, and that's why he was prescribed it. Some contradictions. Sorry, going down. Contradictions for salbutamol is just if they have any like thyroid issues, overactive thyroid glands, diabetes, high blood pressure, any abnormal heart rhythms or abnormal EKG readings, like with the QT phase, or just low amount of potassium in the blood. Beclomethasone, anything of tuberculosis, herpes, infection due to any parasites, osteoporosis, measles, chickenpox, or if you've had those things, these can, or glaucoma, these can be some contradictions of to not use it because it could be some adverse reactions or effects. And then dosing. So salbutamol, like I said earlier, is just inhaler 2 puffs whenever needed. And then beclomethasone is just 50 micrograms twice daily. So you can take it morning and night. Just try and space it out. Adverse reactions, salbutamol is trembling, particularly in the hands, nervous tension, headaches, like sudden noticeable like heartbeats, like where you kind of just notice it more, muscle cramps. And then going into beclomethasone is just body aches, congestion, cough, difficulty breathing, dryness or soreness of the throat, fever, hoarseness, runny nose, tender swollen glands in the neck. So that could be like the lymph nodes, trouble swallowing or voice changes. And obviously like who to call. So if there is any adverse reactions, if it is life-threatening, definitely call like 911. Try and get like ambulance, go to hospital, whatever you need if it is a life-threatening situation. If it's not and you're just starting to feel these things, definitely check in with your primary doctor who's the one who prescribed you these things, just to make sure everything's safe. So that's my video for this case study. And obviously if this is kind of what I'd use to talk about with my patient, but since I'm not the one prescribing it, most of this should be done by the doctor, but it is good to know these things about the medications that our patients are taking. So that was the video for that. And I will try to end this now. Let's see, stop sharing. And then